Up next, we've got Kaji-san from Tohoku University in Japan.
Good afternoon, everyone. I'm Hirokazu Kaji from Tohoku University, Japan. And the title of my talk is Delivery System Using Micropatterned Polymeric Nanosheet. And I would like to talk about efforts on the subretinal delivery of monolayered tissues using ultra-thin polymeric films. And I have no conflict of interest regarding my talk. As you know, many of the causes of visual loss are derived from the retinal degenerative diseases, and the retinal degeneration is the deterioration of the retina caused by the progressive and eventual death of the cells of the retina. In particular, these retinal diseases are intractable, and fundamental therapy is only to delay the progress by drugs shown here. For instance, the most simple way to administrate drugs to diseased retina is instillation and intraocular administration. However, drugs administered in these ways immediately disperse and are metabolized. So frequent administration is required. As these retinal diseases are common in the elderly people, and Japan is one of the most aging societies in the world, the establishment of effective therapy of retinal diseases has become a big pressing issue. In our group, we have been developing various micro and nanotechnologies, including microfluidic devices, surface processing, polymeric nanosheets, and so on. We are aiming at medical applications of such technology, in particular to the ophthalmic fields. We are recently working on a transcranial DDS device that can deliver drugs to the retina by the transcranial route, and also a cell-based culture model of the ocular fundus within the microfluidic device for disease modeling and drug discovery. Today, I will introduce intraocular cell delivery using polymeric nanosheets aimed at the treatment of AMD. As you know, the AMD is a major ophthalmic disease that causes visual impairment and blindness, particularly in the elderly people. The pathogenesis of AMD is believed to result from the development of subretinal colloidal neovascularization triggered by an increment in secretion of vascular endothelial growth factor from RPE cells. The developing colloidal vessels invade below the membrane and disrupt the RPE monolayer. Subsequently, degeneration of photoreceptors occurs and results in permanent visual loss. So, subretinal transplantation of RPE cells to the site of degeneration would offer an ideal treatment, providing the transplanted cells could generate a monolayer, reconstruct the RPE photoreceptor interface, and inhibit further development of colloidal vessels. So far, several kinds of drug administration have been practiced for treating retinal diseases. However, as I said, these are preventive treatments basically. The retinal tissue do not have self-renewability. Cell transplantation is required to fundamentally treat these diseases. Although transplantation of autologous peripheral RPE cells has been tested by injection of cell suspensions using a syringe, limited visual improvement results due to the low viability of the injected cells, their restricted distribution and integration into the subretinal tissue. In fact, Professor Abe, who is a co-author of this paper, previously reported the transplantation of epithelial cells into animal models of AMD and found that similar problems occurred in the animals, and that these difficulties held back further experimental development of potential therapeutic treatment. As a consequence of these problems, tissue engineering is expected to provide innovative therapeutics and regenerative medicine by directing cellular organizations using micro and nanofabrication techniques. Efforts are in progress towards an alternative approach which involves the local delivery of an engineered RP monolayer using biocompatible devices. There have been several reports on the development of natural and synthetic substrates for cell delivery using various materials. However, these engineered substrates are typically micrometers in thickness and several millimeters in size. Therefore, they are not sufficiently flexible to be aspirated and injected through a conventional syringe needle into the narrow subretinal space. Also, as most of the people here know, recently the Japanese group in Riken decided to perform clinical trial with iPS-derived RP cells. In view of these backgrounds, it is significant to develop substrates to achieve minimally invasive delivery of the engineered RP monolayer. So, what is the polymeric nanosheets? It is a relatively new class of soft nanomaterials that are under study in the polymer physics field. Its typical thickness is 10 to hundreds of nanometers, and the size is hundreds of microns to centimeters. This kind of polymeric nanosheet is highly flexible, unlike bulk polymeric films, because in addition to these properties, nanosheets are physically adhesive. They have been used for cosmetics and surgical dressing so far. Recently, we reported that nanosheet can be used as a cell culture scaffold because cell nanosheet composite is very flexible as well, so we can wrap a silicone tubing with it, and also we can bend it like this. So we came up with an idea that cells cultured on nanosheet could be delivered to damaged area of the retina by using a syringe needle. So in this study, we fabricated a functional nanosheet by micro-patterning techniques and cultured RP cells on the pattern nanosheet. Also, we evaluated the viability of RP cells on the nanosheet following the syringe manipulation step for transplantation of the engineered RP monolayer. Micro-patterning of nanosheet can be achieved by the combination of spin coating and micro-contact printing using PDMS mode. So here is circular nanosheets consisting of biodegradable PLGA and magnetic nanoparticles patterned on PVA-coated substrate. Because actual nanosheets are difficult to see due to its low thickness, we embedded magnetic nanoparticles into the nanosheet in order to improve optical visualization and manipulability. Still, the whole thickness of the sheet doesn't change. The dissolution of PVA sacrificial layer allows the release of nanosheet from the substrate. As you can see in this movie, the micro-pattern nanosheet can be aspirated and injected through a syringe needle or intravenous catheter whose inner diameter is smaller than that of nanosheet because of the highly flexible structure of the nanosheet. Despite the incorporation of the magnetic nanoparticles, the micro-pattern nanosheets are capable of deforming flexibly inside the catheter needle, determined by these optical and fluorescent images, and could bend along the inner wall of the needle. Also, due to the magnetic properties of the nanosheet, the freely suspended nanosheet can be remotely gathered in one place using an external magnetic force. These are RP cells cultured on the nanosheet, and live dead staining showed these cells are viable. This confocal image shows a monolayer formation by the cells colored green and the nanosheet colored red. So in addition to monolayer formation, the RP cells form the densely packed structure that is critical for their ability to function as a barrier under physiological conditions. These images taken after 2 days of culture showed that cells on the surface with magnetic nanoparticles have a hexagonal structure with abundant formation of tight junctions. By contrast, the cells on surfaces without magnetic nanoparticles are randomly organized. Though the details are still under investigation, we anticipate that the greater surface roughness would enhance cell migration and proliferation, result in faster maturation of tight junctions in the epithelial monolayer. Next, on the assumption that the transplantation of RP cell nanosheet composites will be carried out using conventional syringe needles, we evaluated cell viability following syringe manipulation. Despite the mechanical stress during syringe manipulation, the RP monolayer retained its original shape without distortion, and more than 80% cells were alive even after they were injected through the syringe needle. Next, we also evaluated the effect of the thickness of the sheet on cell viability. The micropattern nanosheet with thickness over a few hundreds of nanometers retained viable cells on the surface. On the other hand, those that were micrometers in thickness retained few cells, with most showing low viability. We assumed that cells on the micrometer thickness sheets had been scraped from the surface during manipulation, resulting in only few cells remaining. Such phenomena would be explained from the feasible elastic properties between cells and the nanometer thickness sheet rather than the micrometer thickness sheet. The more flexible subset could retain the cellular organization under the mechanical stress. Finally, we used our system to deliver a micropattern nanosheet to the subretinal space of swine eye ex vivo. Before injection of the nanosheet, the subretinal space was partially filled with saline in order to secure the transplantation site. From this movie, you can observe the nanosheet is successfully injected and spread into the subretinal space. It then attached to the macula and retained its circular shape after removal of the saline. Here is the summary of my talk. And I would like to thank my colleague and student, and also the financial support from these agencies. Thank you.
Thank you, Kaji-chan, for an excellent presentation. We have time for one quick question.
That was excellent work. Thank you. Quick question on, you showed us viability, you showed us mechanical property, essentially structural integrity as well. What about functionality? Is that the next step to look at how the cells would respond?
Yeah, it's still under investigation. So we are now using the animal models of rats and rabbits.
How would you test that?
And the cell nanosheet composite implanted under the retina.
Okay.
And we are checking the function.
I see.
Yeah.
I see. Very good. Thank you.
Thank you very much.
Thank you.